The principles of orthopedic treatments. There are 4 principles of orthopedic treatments. These principles describe the direction and progression of manipulations. General, specific, general. Superficial, deep, superficial. Proximal, distal, proximal. Peripheral, central, peripheral. The first 2 principles refer to how techniques are applied to an area of the body. The first techniques are applied generally and superficially. These are followed by techniques that are more specific and deeper. The therapist then returns to more general and superficial techniques before moving to another area. The sequencing has some reasons. It allows you to palpate through layers of tissue. It increases local circulation and warms up the area to prepare the tissue for deep work. It reduces sympathetic nervous system firing. It prevents the subsequent techniques that require deeper pressure from being painful and feeling invasive. Proximal to distal to proximal refers to how techniques are applied to the limbs in order to increase the local circulation of blood and lymph. Both the pressure and overall direction of techniques move towards the heart. When you work on the arms and legs, start closer to the trunk. When a treatment is begun on structures closer to the trunk, hypertonicity and restrictions are reduced in these tissues, allowing for more efficient venous and lymphatic return from distal parts of the limb. For example, start proximally at the muscles of the hip and work distal to the lower leg, then foot. Once this distal work is completed, deeper effleurage is used from the distal foot to the proximal hip, encouraging local venous return. With an injury in the acute or early subacute stage, the injury is considered the most distal point at which to perform techniques that affect the circulation and lymphatic flow. Therefore, you will work from the trunk to the injury site and back to the trunk. At this stage, massage over the injury site is generally not indicated. Massage distal to the injury site consists of stroking or gentle muscle squeezing. Avoid techniques which increase venous and lymph return, since painful congestion of the injury site is possible. The principle of peripheral to central to peripheral is used when you treat painful areas or scar tissue. If the therapist focuses directly on the painful tissue or source of dysfunction, it may be painful and tissue will react reflexively by tightening. Rather than trying to massage away localized pain, it is often a good idea to begin work in a satellite area that is not too sensitive and slowly expand that area into the painful area. Scar tissue and myofascial adhesions are generally more accessible and less adhered at the edges, and therefore easier to break down. Only after the peripheral restrictions are released does the massage progress to the most adhered central area. Moving back to the periphery reduces the possibility of kickback pain.